director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health. Well, it's heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, and fascinating health topics, and of course, where we do encourage you to call in to join in. Well, today, folks, it's a Friday. First Friday in October, a get-em-up, out-of-town version of our show, if there ever was one. Yes, we're going to allow you to open it up, take command of this thing, wherever you decide you want to do that. Anything on your mind is okay with me. We've had enough topics, controversial topics, in the last many, many weeks, and you may still be having a number of issues with it. I'll be talking about some of those issues today, but, of course, waiting for your knock on the door at any time to allow you to come on in the store and ask that question and get that comment off your chest. You just don't want to let that pressure build up over the weekend. It's bound to cause you some serious medical issues. Let it loose, or let it go. Bring it to all of us today. We'll all enjoy it together. 412-825-6262. Enjoyed, did you not, our little session with Dr. Vavavoom yesterday, or rather on Wednesday. By the way, I've got my list. I haven't got the website yet. You know, she said there are 10, or maybe there's more, but I don't think so, 10 different body parts that have 3 letters associated with them and 3 only. And I got to 9. I think I got to 9. I don't know how far you got, but I am going to go to that website. I'm going to find out which one is eluding me, because I do believe I'm missing just one. How many are you missing? You can check it out by going to SusanSmithJones.com, and in her October newsletter, which you click on at the opening page, you can find out sooner than me, because it's going to take a while for me to get to that point. Anyway, Susan Smith Jones will be returning next month. We've already booked it. I'll give you the date in just a moment. Monday, we're going to talk about Monday's show in a little different context. I want to elaborate. It's going to be Dr. Emil Shandell from Fort Lauderdale, Florida. He's been in Pittsburgh before. He was a speaker up at the Freedom in Cancer Therapy group, Freedom of Choice in Cancer Therapy group in March of 2011. He was a guest on our show at the time, and issues surrounding cancer. In a moment, I'll share with you. If you have cancer, if you know a person who had cancer, by the way, I like that term, had cancer, and thinks that they're cured, that may be a debatable item. There's a way to find out for sure, and we're going to be talking about this HCG test here in a moment today, and then getting you set for Monday. He is our guest to talk about what he calls the cancer profile that he invented and utilized in his lab. Only lab in the country to do so. Next Friday, yes, Dr. David Brownstein will be back. New topic, because there's a new book, folks. One that he penned in the month of August when he wasn't here with us. He was writing another book. It's called The Soy Deception, and we'll see how deceptive that little product is. I think that when the proper information is brought to your attention, you may look a little bit askance at this subject of soy and how you want to take it, and if you want to take, and in what quantities you want to take it that you may have never considered before. Of course, looking in November, we already got 2 scheduled dates in November. Roland Thomas going to be talking about his product, which is a bioengineered algae concentrate. He's the gentleman who connected with Dr. Michael Kiriak, the Soviet scientist. I believe they make the finest supplement going, and all wrapped into one. I call it the all-inclusive. And but this item is more than a supplement. It's able to be used when there are medical issues going on. That's what Kiriak used it for, first with animals and then with humans. with the Chernobyl accident of 1986. And now, Roland is taking on the topic of diabetes with these supplements. We'll be talking to him on the 7th of November. Susan Smith-Jones returns on the 9th, and she wants to talk about, hey, I think it's appropriate, 10 tips to not gain weight over the holidays, because we'll be arriving there soon. Anyway, I hear a knock on the door. Come on in the store. Hello, and welcome aboard. What is on your mind?
Hi.
Hi.
Hey, Dr. Courtney.
Hi.
I'm calling. I need to find out about my daughter. She had an X-ray. She's been having trouble with her bowel, and they still don't know what's going on. They wanted to do a colonoscopy, but I think it's too invasive. She's too young. She's
How old?
20.
Oh.
20.
How old?
20.
She's 20. Okay.
And so they called me back and wanted to know why I didn't, and I told them, that I'd put her on the probiotics and stuff, and they told me that that wouldn't help her.
Yeah, well,
So
go ahead.
I said, well, they said it would. They said, well, we got her X-ray back of her colon, and it's pretty full, and they want her to take these really strong laxatives to flush her out.
Yeah. Just some quick notes here. Of course, I don't know if you've been listening as early as maybe just 2 weeks ago when we had Constantine Monastersky on here. We were talking about colon issues in particular and the role that fiber takes in the development of these problems. Does your young daughter, 20 years old as she is, does she use fiber a lot in her diet?
Yeah, she eats a lot of salad, a lot of fruit.
Mm-hmm. Any other source, for instance, has she always had elimination difficulties, or is just this one time out of the blue, hiding her hair, history of this in the past? This is
No, it started when she was like 10 years old.
Okay, here we go.
It was back and forth from, going too much to not going at all.
Okay, so you're at a point now where you're at a crisis. She's maybe even impacted. But one thing they can determine from the X-ray is, and they use the term full. I think that's a very appropriate term to use. And if she's not having bowel movements, and by the way, does she, and has she, and will she eliminate on her own, or does she have to be purged to do that?
She does. I mean, sometimes it'll come out, then it'll stop, then it'll come out, then it'll stop, and it might be a little bit at a time, and then at other times it's diarrhea. So it goes, back and forth.
All right. This may even be a condition of either ulcerative colitis or IBS. It's getting a little more complicated. Let's just say on the issue of the elimination problem for now, if she's so impacted or full, as the doctors have said, so as to, they're seeing a large accumulation of fecal material, and it's going to have to be relieved as an urgent issue. Whatever advice they can provide in the way of purging that, even if it means enemas. I will tell you that there are two recognized, rather safe ways of doing this. One is going from south to north. I don't know if suppositories have been used by your daughter. I'm going to guess they have. Have they?
No, they haven't.
Okay, well.
It's the first time we've ever known this.
Okay.
Because she said that it wasn't totally full, but it was really too full, and they wanted to put her on the medicine that you take before a colonoscopy to cleanse her out.
Yeah, it's called Go Lightly. I'm very familiar with it. It's a gallon jug. Yeah, it's a gallon jug with the powder in it. You supply the water, and as a bowel prep, it's a pretty good one, I would say. But nonetheless, the issue of purging the colon in order to eliminate Constantine Monastersky, I want to refer you to a show that we've done. Have you listened frequently to the show, ma'am?
Yes, I do.
Okay, so I'm looking for dates so I can tell you the issue of constipation. If you go to my website, the 26th and the 28th of September, just literally a week ago, we had two extremely good shows on the issue of constipation and regularity and how to avoid the problem and how to correct it. I direct your attention to it. I'm just going to let you know at this point, glycerin suppositories which are you place in the rectum itself.
Right.
These are very safe to use. There really is no consequence to them, and that's the first positive thing I ever got out of Konstantin Monastersky, the expert on this matter, in terms of how you can approach this issue without using fiber laxatives. This is the thing that may have created the problem to begin with, and nonetheless, because she'd taken the so-called stool softeners throughout her 10 years of being afflicted. Do you know?
No.
Okay, well, at least she hasn't supplied that as an additional problem. But glycerin suppositories, number 1, and magnesium and vitamin C, number 2, because these are water-soluble. They do provoke the flow of material through the colon based on further accumulation of water, which is extremely safe. So for right now, let's just say, to get her out of the jam, those would be 2 ways of accomplishing it, and maybe you can just avoid that colonoscopy for now.
Yeah. That's what I was afraid of, and they did a blood panel, and it showed that her B12, her vitamin D were both so low.
Well, the vitamin D, they can't be shocked. You're Western Pennsylvania resident at least, and everybody's vitamin D is so distressed that you have to supplement for it specifically. And when I check these levels, I rarely, if ever, find vitamin D that's even in the normal range. Normal range is 34 nanograms per deciliter, and when we put people on vitamin D, we've got to get them up to levels of 80 and 90. It takes a while. As far as the vitamin B12, that could have a connection to the terminal ileum. That's where B12 is absorbed, and so there may be other issues here that deserve exploration, but this colonoscopy itself can't get to the ileum, so I don't understand what the problem is here. If you're trying to diagnose a B12, you can't get beyond the cecum, and the ileum's on the other side of it. So just a word to the wise there with respect to the B12. It could be the lack of an intrinsic factor. The young girl needs to be worked up. As to whether worked up to get to a diagnosis, because right now all you have is fullness in the colon. That unto itself doesn't necessarily mean that you should have a colonoscopy done. However,
she was bleeding really bad.
Oh, well, now another. Yeah, okay.
Constipated, which I thought that it was probably hemorrhoids and maybe, fisters. I don't know.
Well, bright red blood? Was it bright red or not? Or don't you know?
Sometimes it was a lot, and then other times you could see it even in the stool because it was so hard.
Yeah, well, the hardness of the stool is one thing, but if it's bright red, predominantly, that really is highly suggestive of hemorrhoids right at the distal portion of the colon. And so because she may strain a lot, and it has done so over time, these hemorrhoids have really burgeoned out to the point where they're easily bleeding. I'd be happy to discuss this with you on a one-to-one. Come on in, please. I'd love to meet your daughter. There's going to have to be something done on the long haul to get her out of this jam and keep her out of it. You're right about the probiotics, meaning having done so. The probiotics, they believe, won't help her, and they may be accurate, but absolutely will not hurt her, and ultimately going to have to play a role in her overall correction because the flora of that colon has to be restored. It's difficult to do, but it's got to be attempted, and now is as good a time as any, and it'll be continued well into the future. Okay, ma'am?
But you're not suggesting the colonoscopy.
From what I know right now, if you
to empty it.
No, emptying it is primary, and it doesn't seem, the colonoscopy can't even be done if the colon isn't empty. They can't do colonoscopies if the colon is completely full of fecal material. So what they're saying is they're going to use Go Lightly to clean her out, and then they're going to go up the colon to try to determine any diagnostic things that they can gain from that particular study. But the two are inconsistent. You can do no colonoscopies unless the colon has been purged and cleaned first. So the issue is get her unloaded with the fecal matter. I'm giving you the safe ways to do it. To Go Lightly is pretty strenuous, although safe. It is a better way than using any fiber-contained laxatives. But in terms of the colonoscopy, it won't even be considered until the colon is cleared. So getting her out of that crisis is the first step, it appears, on both sides of the equation, both your daughters and her doctors. So get to a...
Saying mostly the glycerin suppository.
Well, certainly that is a safe way of handling this matter, and it would allow for purging, and it won't cause any problem. It won't harm her. Taking fibrous bowel laxative would be the worst thing to do here, even though that's what the majority of doctors would consider putting her on. Go down the school softener route, and let's say this is it on the matter for now. I'd love to meet you one-on-one to come on in here. This is enough of a consultation over the phone. Let's do it face-to-face.
Thank you.
Absolutely. Okay. Just applied the Constantine Monastersky approach, which I think I've answered in a way that he would do so. All right. Let's do this. Let's take a short break. When we come back, I'm going to talk a bit about our Monday guest. By the way, remember, this is a Get 'em Up Out of Town version of the show. It is a weekend, and what a gorgeous weekend it will be. Hope to be able to send you off feeling and smiling wonderfully. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to An Impact on Your Health. Here on a Friday morning, Get 'em Up, Out of Town version of the show where we allow you to call in and take command of this thing and drive it down the road a bit, see it, kick the tires, and find out how it runs for you. I hope it's running well for most of our listeners. But you may have a question or a comment you'd like to raise. In either case, the number to do so, 412-825-6262, and we'll give that number additionally throughout the hour. We do have a knock on the door. Let's go to the caller. Come on in. Hello and welcome aboard. What is on your mind?
Hey, Doc, I heard you talking Monday. This is the driver that called you last year about the faulty.
Yeah.
Yeah, it is not flowing.
Right. It's not running at all.
Not at all.
No, that's right. They had to tear it down. I remember that. By the way, it's nice to talk to you again, by the way. We really
good stuff to you.
Really appreciated that advisory last year. Believe you me, if that fountain was working, there would be pink stuff sprouting from it. It sort of just was an automatic every year. I just hope that next year, even though I enjoyed the fact that there's Breast Cancer Awareness Month, I just don't like the idea that mammograms are going to be resulting from that sort of hint that they're giving women to go and make sure that their breast health is up to snuff. But yes, it is true. The fountain is in disrepair. It's all dug up down there. They're trying to get it fixed and functioning. I don't know when the targeted date is to have it flowing again. But let's just say I'm sure that by the time next October rolls around, you'll be able to report that the fountain flows pink.
Yeah, there is a building next to, it's like one or two buildings over from PNC Park that has a stream that looks like it's flowing down toward the river. It has pink water in it.
Well,
it has nothing to do with the fountain.
Nothing to do with the fountain. Well, I know there's quite a distance separating the two and a river between. Nonetheless, you're out on the road again today doing what you do, huh?
Yes, sir. I do have a question, though, for my mother.
Go ahead. Let's see if we can help you.
She has microscopic, I think they told her diverticulitis.
Okay.
And they told her to take what I think I just heard you say not to do is like a fiber type supplement.
Yeah.
And I do have her on, she does take the probiotics and what the heck else? There's a couple other things she's taking. And I want to, should she listen to that show from the, I think you said the 27th of September?
It was, I'll give you the exact dates once again. I've never done as good a job on this subject of constipation in all my years of doing this show. With the help of Konstantin Monastersky, the dates are 26 September and 28 September, Part 1 and Part 2 of constipation issues. In there, your mother will be able to appreciate the reasoning behind it. Let's just say that from what I now know, the worst thing a person with diverticulosis could do would be to take fiber, stool softener, laxative of any type, because the volume of fecal matter will be much greater and the intracolonic pressures will rise. That would be the absolute, positively worst thing to do. You have diverticulosis, which are outpouchings from the wall of the colon, and if the pressures rise, those are going to make those outpouchings get even larger, dilate, and if any fecal matter gets trapped in and become inflamed, potentially rupture. It is the standard operating procedure in medicine to encourage the use of stool softeners, but those stool softeners are high fiber content, and they are the wrong way to do it. The better way of handling this issue of constipation is either, if you're going to go south to north, if you know what I mean, glycerin suppository is extremely safe, and if you're going to go north to south, then the use of either higher doses of oral vitamin C or magnesium will be a safe way to handle it, because neither of those cause the increased pressure in the colon. They present an increased amount of fluid and liquefy the fecal matter so it can be discharged. So that's the short answer. The laxative or the fiber thing is the worst recommendation going. I understand why they do it. It's the standard routine for all doctors to use that, but after I've had explained to me what I didn't know of in the past, I now know that would be the worst thing to have that person do. Anyway.
Okay, she is taking additional magnesium, and I did have her stop eating gluten products and dairy.
Well,
I don't know if that's a good idea.
Well, no, there's the gluten product. I mean, she has a gluten allergy. That would be something completely different. Gluten products don't necessarily have to be high fiber. Okay, so I'm just saying avoid the fiber.
Okay.
So that's the thing that's going to cause the problem. And those, things like Metamucil, one of the most common of the stool softeners generation, which that's high fiber intake, and it would cause an increase in intracolonic pressure, which is the absolute worst thing to do. Now, it may rescue you once or twice, but the hazards of that rescue in a person with diverticulosis may lead to a rupture of what we call it, a colloquial term, a blown tick, if you know what I mean. We call it blowing a tick. And if you blow that tick, you are leading your way to peritonitis, which is extremely serious. So go south to north or north to south with the magnesium, vitamin C, and you'll work your way out of this. Laying down the floor and doing those other things, I definitely applaud you for. And keep on the road, keep it straight, and keep calling us up. We'd love to hear from you.
Okay, I just real quick, she's had diarrhea for 10 days. What do you suggest for that?
Oh, okay. Well, that's another matter altogether. Well, that's going to take care of itself. Now, that won't have any harm to her with respect to her diverticulosis, okay? Because that's watery stool. That's not going to cause an issue. As to why she may have that, I don't know whether it's a toxin. I don't know whether it's a gastroenteritis. These are other matters that you certainly wouldn't be taking a laxative for at all anyway.
Okay.
Okay?
Which makes sense. Okay, thank you very much.
Absolutely. Thanks for the call. All right. Hey, folks, he's on the road. Remember he called us last year and told us that the fountain was pink on October 1st of last year. And, of course, there's no fountain now at all. Hey, you see how this works? You can call up at any time, 412-825-6262. We are in a Friday morning posture, a get-em-up, out-of-town version of the show where you can set the agenda. I've got a couple things on my plate I can bring to you, but at any time, feel free to give us a call. I want to talk a bit about Monday's show. I think you don't want to miss this one. We're picking up where we had left off a number of months ago. I think this issue was first brought to our attention by Bill Henderson. Bill, I get his email every month, his newsletter every month. He's a very ingenious guy, a non-doctor, who put together various protocols to treat cancer literally in the home. Okay, so I applaud Bill for doing his due diligence with respect to the recommendations that he brings to you. I will say that I think Bill's real bonus is for those people that do not have access to any alternative medical personnel in their region, where they're literally left on their own. They may be, look, I'm thinking about Wyoming or Utah. You could be hours away from any medical attention, let alone to find an alternative doctor out there. So what are you going to do if you have cancer and you're sitting in some remote area of the country? Bill's advice and Bill the protocol that Henderson has used is a very good way for people in that particular situation to take care of themselves. One of the things that he recommended back then, when he came to Pittsburgh, and he did speak at the Freedom of Choice and Cancer Therapy Group, was this test that he said you could get to easily determine if you had cancer at all. And it was a method of testing for something called HCG, that stands for human chorionic gonadotropin, which is elevated in the majority of any kind of cancer going. The problem was that I felt, and I looked at this very closely at the time, that the only place that you could get, at least according to Bill, get this test done was sending the results. You did your own urine test. You had to expose the filtrate that you got from filtering your own urine to acetone, do a number of other things, and then you had to send it to the Philippines. I never liked that idea. I never encourage anybody to do it because I don't like the idea where it's determined, the specimen is going to be determined by a non-medical person that has to prepare it to get it shipped. It's just too much error in that kind of thing for me to feel comfortable in recommending it, and I never did. Still, I have come across patients, one just last week, who has done that and went through the fuss and the muss and actually did get a result from the Philippines. Dr. Navarro in the Philippines was the gentleman who did that. I was under the impression that Dr. Navarro's test was the only place in the world where you could get HCG testing of that sensitivity. Turns out that is not the case. That in fact we have a very sophisticated laboratory in Fort Lauderdale, Florida, where not only is the urine test done, by the way, the urine test is the least accurate test going. And so that was another reason the false positives and the false negatives that could be expected with a specimen sent to the Philippines, for God's sake, were just too much for me. I couldn't recommend it. But Dr. Emil Shandel is going to be our guest on Monday. And he's devised a cancer profile that is able to do 3 tests for HCG, extremely sensitive testing, And if you get 2 out of the 3 positive for the HCG, pretty much you can consider that cancer is looming about, whether you actually know where it is or not. This is why I say if you do have cancer yourself, and maybe you've been treating, and you think that your doctor's now telling your cancer is in remission, that's a good word, was cured. I doubt if they use the C word. It's very difficult for a medical person to use the C word. Or at least you assume that you have done your chemotherapy, that there's no evidence right now of any cancer any other place. I think you want to hear about HCG testing, which can show up positive in a cluster of cancer cells as little as totaling the number 12. 12 cancer cells alone, and the amount of HCG that they put out. We'll talk about how it is that cancer cells would do that on Monday with Dr. Shandel. It is pretty good accepted science that cancers do put out HCG, and to be able to identify a cluster of cancer cells as tiny as 12 cells, there is no other test that I know of that can do that. Anyway, I ask you, and you'll want to pay attention to Dr. Shandel's return to our show on Monday. We're going to be talking about the testing, talking about the theory behind it, and then to let you know that we have the test kits here. If you, in fact, would like to have this kind of testing done, it will be available to you. No sense going to your doctor and asking to have it done. They won't understand why you would want such a test, and they would order a blood test, as they do for pregnancy, because HCG is found extremely elevated in pregnant women. When women go to get a blood test to find that they're pregnant, that's what they're searching for, HCG. So this is a substance, a hormone that is available to you for other reasons other than pregnancy, and the wonderment of that allows for this other testing to take place that would assure you that you beat the cancer, or let you know that you didn't, and not be sitting around waiting for a lesion to finally surface that you think shouldn't be surfacing at all because you think that you have weathered the storm. Well, I'm going to put it in your hands to be able to handle that on the Monday show. So pay attention on Monday with Dr. Shannon. Another thing I want to bring to your attention, look, MCG testing has returned, folks. We had a enjoyable day yesterday. Multiple patients came in and were tested. Some of them, well, the majority of them were retests. Some of those folks that were in here yesterday it was their first test. This, of course, is MCG, multifunctional cardiogram testing, is a pretty space-age way of determining the status of your coronary arteries. So accurate is this, it's 91% accurate when compared to the results of a cardiac catheterization. 91% accurate is a pretty good degree of accuracy for a completely non-invasive test that allows you to lie literally on a bed for 6 minutes. This device, in a way that you can't even perceive, because you're just lying, you're comfortable, is sweeping you like an EKG would sweep you every 82 seconds. Another test is completed, so in the 6 minutes you have 5 different tests run, and then we send that information off to be compared to a 42,000 patient database to get your ultimate score, and we will know how much plaque you have in those coronary vessels without ever having to have a cardiac cath at all. Glad to be able to bring it to you. I'll be announcing by next week the next time we're going to be doing MCG testing, because now we actually have the device in the office. We've bought it, we've procured it, and as such, it's not going to be anything where we have to be coordinating with Jerry Singleton. Jerry Singleton has been very nice to help us present this in the past, but from this point forward, we'll be doing it on our own, folks. All right, another knock on the door. Come on the store. Hello, and welcome aboard. What's on your mind?
Yes, Dr. Courtney.
Yes.
I was wondering, I have a son. He's 42 years old, and ever since he's been in his 20s, he's had hemorrhoids, really bad. And he's went to the doctor before about years ago, and, they bleed a lot, and It's like he's not constipated or anything, but he just has hemorrhoids. What would you suggest that I would get for him for hemorrhoids?
Well, what you may get for him will never solve the problem. There's going to have to be some intervention. Let me describe a couple of them to you, okay?
Okay.
Going from the least invasive to the most invasive. Least invasive, there are actually non-medical doctors that more than likely will have this available than the medical community. I'm thinking about a doctor out in Ohio. His name will come to me, that has the ability to use heat cauterization to cause the vessels to literally be destroyed. Okay? So that's a pretty safe way of doing it, because just by inserting a probe into the rectum and applying heat to these vessels, they will be able to be damaged and necrotized to the point where they can't fill up with blood anymore, and the bleeding would come to an end.
Oh, wow, that's good.
Okay. A second way, and the more common way and easily defined way around here, is this banding. I don't know if your son has ever consulted with either a colorectal surgeon or a proctologist, but these two individuals in particular, even general surgeons, are able to do banding, where they use a rubber band material to literally constrict these vessels so they can't fill. Now, I have to say that there's an opportunity for them to return, but at least as an interim measure to try to avoid the ultimate, which is a surgical correction of the problem, which absolutely in some cases might need to be employed to get this completely reversed so it can never occur again. But those are how I see the interventions here. The heat cauterization, the banding, and then ultimately the last choice here would be the possibility of surgery. I will say, as we have learned, that he cannot be put in a position of straining to defecate, because if he has any degree of constipation or difficulty eliminating, it's the very act of defecation, of going to the bathroom, of having a bowel movement, that causes these hemorrhoids to engorge themselves with blood and to bleed. So that's another secondary consideration, to make certain that the ability of the stool to pass out of the body isn't what is causing an increased amount of pressure. And I would suggest, just as I did with the previous patient, that generous doses of oral vitamin C, which is water-soluble and has a bowel tolerance, will loosen stool, and magnesium will do the same. And so mag chloride, mag citrate, mag glycinate, magnesium that is, are great supplements to take anyway to get an electrolyte benefit, but in the same time, you're able to increase those to bowel tolerance levels so that someone with hemorrhoids doesn't have to strain at all in order to perform the act of defecation. I hope that is helpful for you, ma'am.
Oh, it certainly is, and I appreciate your help, and I thank you very much, and I love your program.
Oh, keep on listening. Thank you very much for the call.
What, you wouldn't happen to be related to a Blaine, Courtney, would you?
No. Now, where's Blaine from? Because
he was a school teacher of mine. I'm 65 now, but he was a school teacher of mine in high school.
Well, you know what? Little fact that is relatively forgotten is that I was a high school teacher. Now, my name's not Blaine. It's Dennis Courtney.
Yes, I know. This guy here was he was in the military. He was a Marine.
All right, that wasn't me. I am not the Marine.
History.
All right. Well, what school district, by the way, was that?
Connellsville.
Connellsville? Okay, absolutely wasn't me, but heck, I hope you run into that Mr. Courtney that you knew very well from your own high school education. Thank you very much for the call, man. Okay. Anyhow. All right, let's take another short break. When we come back, I'm going to talk a bit about some thyroid issues. I think I hear so many questions when we open them up for calls around here about thyroid. You have a lot of thyroid interest, at least you've demonstrated it that you have. I really get involved quite deeply with thyroid treatment. I'll share some thoughts with you on my return. Don't forget, you can call up and take command of this place too.
been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact with Your Health. During a Friday morning, get 'em up out of time version of our show entitled AM Impact on Your Health. Today, we're letting you come on in and take control of this place. Set the agenda if you'd like to. Any question or comment is certainly appropriate. 412-825-6262 is the number to do that, and I'll wait for your knock on the door, and I'll let you on in the store. I want to share some thoughts with you. So many questions come to me on the radio show as well as outside the radio show. There's a lot of interest in thyroid out there, and with respect to that interest, I thought I'd bring a couple salient points that maybe help point you in the right direction and allow you to become more sophisticated in how to assess your own need for thyroid replacement. If you're being treated conventionally right now by your doctor, you are very unique. And the reason you're so unique is in order to be able to be considered to be treated by your medical doctor, your laboratory tests have to be so far askew to what's considered normal that the doctor could not avoid detecting your thyroid disease, because clearly there it was, written in the wind with the very lab test that he ordered for you. So, with respect to those who are being treated by the conventional medical community, you have to be careful on how you know that your actual treatment is appropriate and is being tailor-made for you. Because once placed on a thyroid hormone, which, by the way, 90% of the time is something called either Synthroid or straight T4, which is one of the thyroid preparations that it can be taken. There are 2 thyroid hormones. One's called T4, one's called T3. And T4 is not biologically active. T3 is. But to become T3 from T4, which is where the T3 comes from, it has to be cleaved in the body, and a certain set of biochemical reactions has to occur, and in many patients, they do not have the ability to cleave the T4 to the T3. There is no blood test to be able to assess whether that can be done or not. And so, if you're placed on T4 and you can't cleave to make T3, then, as I have often said, the T4 is useless. It is a dud, and you can take a truckload of it and not get any biological bang from that truckload. That's why I can't ever use Synthroid, because I have to just make the assumption that you can't cleave. There's no way of really determining it, and so T4 has never been used by me, but I know it's being used by your conventional doctors. 90% of the time, they are putting you on Synthroid, and that's a problem. And here's why it's really a big problem, because a doctor puts you on a dose of it, and then he watches how your laboratory results are going to eventually swing toward a normal laboratory picture. And so you're placed on a dose, and then the dose, once it's established, is established by, I believe, an incorrect step. And that incorrect step is worrying about, are the labs telling me everything is all right, instead of listening to you to find out if you think everything is all right. And this creates a giant bit of confusion from a patient and a doctor relationship viewpoint, because the doctor will tell his patient that he placed on T4, which may very well be doing nothing, that when he begins to see the lab test, and the lab test will change because T4 registers on the lab, it just doesn't register maybe in you. And so as he sees the blood work start to gradually move into the positive direction, without ever asking how you're feeling, other than maybe just that, hey, how you feeling? But not really getting into your specific symptoms, he announces that we have arrived at the therapeutic endpoint, that, oh yes, those laboratory results are now smack dab in the middle of normal, and so we're going to keep you on that particular dose, whatever that dose was, forever. And you get consigned to not having this issue come up ever again. It's just now assumed that we'll continue to be looking at that lab work maybe once a year to make certain in the mind of the doctor that all is well, when in fact you may not be well, and more than likely are not well at all, because you have all the symptoms that you had when you first started. You feel no different many times, and yet you're told by your doctor that this is therapeutic endpoint, and there you stay, and never question again. As you would well know by now, we never use lab work here in the office to make the diagnosis of thyroid disease. It is only based on two parameters, your symptoms, and we document them pretty doggone well, and your basal body temperature. And with those two alone, I say only with those two alone, never looking at the lab to be dissuaded from thinking that all is well, because it very much is not well when your hair is falling out, when you have an intolerance to cold, you're always cold, morning, noon, night. You're the lady who wears the sweater in the middle of August, and I know you many times. I've seen you after dark with that sweater on, and I'm amazed. And then even before it's dark, okay, you ladies pull out that sweater. Constipation, morning accentuated fatigue, brain fog, disorder, dysfunction in menstrual cycles, the list, infertility, the list goes on and on and on. These questions never seem to come up with your conventional doctor, and I will tell you that when you hit the right dosing with the right product, you can expect all of them to turn around, and that's our goal around here. So that was the bit of information I wanted to provide for all you ladies out there that are on Synthroid, placed there by your doctors. You would had the diagnosis made because your lab tests were not normal, which means, by the way, that you're really sick. If you are one of those unfortunate individuals, in one way, to be so sick to have your laboratory results be abnormal, then if there's anybody that needs to be rescued from their thyroid symptoms, it's you. Yet, once the blood work changes and the new levels have been established, the quest for getting you to feel better is now over, and you may be consigned to a lifetime of agony issues that could have been corrected. So I warn you, do not be deluded into thinking that everything is well just because your lab tests are fine. They should have never been used to start you on a thyroid hormone. They certainly can't be used to determine when you've arrived at the therapeutic endpoint. It is you and how you feel, and it is your basal body temperature together that make that call. Talk to you in a moment about the alternative side of the equation. Many of you are being treated alternatively, and I got some issues to discuss with you too. But we got a knock on the door. Come on in the store. Hello, welcome aboard. What is on your mind?
Hello, Dr. Courtney.
Hi.
Well, one question. Well, probably more than one, but one right now. With the omega-3 and the omega-6s,
yeah.
What is the proper dosage? I remember Mr. Peskin said 2.5 to 1, and the other guy, Ed Kane, what 4 to 1?
Yeah, now this is very interesting because I really think both of these individuals are making a contribution to our understanding and appreciation of the role that fats play and how you should be correcting them. I will say that although he's not a doctor, professor, he used to be called Professor Brian Peskin, is probably the most academically inclined. He has all of the studies down in his mind, and he recites them ad infinitum at the drop of a hat. He's loaded for bear. But he's loaded for bear on the academic side. He is not loaded for bear on the clinical side. He doesn't treat patients at all. He's not allowed. Ed Kane, on the other hand, in combination with his wife Patricia Kane, are very clinically oriented. And so in terms of the treatments and how best to be able to replace those fatty acids, it is the Edward Kane literature that I'm going to continue to refer to. Professor Peskin does not manufacture a product on his own, but he does support a product referred to as YES. Are you familiar with YES, Y-E-S?
No, I'm not.
Okay, well, that's a product that he's put his stamp of approval on, and it's composed of 5 parent oils. But there's just no rhyme or reason as to why he picked the 5, and any proportionality is really not an attempt by him in making that product or endorsing the product. In Ed Kane's case, scientific research by Dr. Yehuda in 1994 has shown us that the proper ratio of omega-6s to omega-3s is 4 to 1. And so I'm going to have to say that I use both of these gentlemen as a resource, but in terms of how you replace it, the 4 to 1 has been scientifically derived. And that mixture of 5 oils in a product called YES has not been subject to any scientific scrutiny. It's just picking parent oils out of the sky, which are better than taking the derivatives like EPA and DHA. I go along with that, but the right ratio of 4 to 1 has been established by Dr. Yehuda in 1994, and it's the one that allows me to promote a product called 4 to 1 oil that Ed Kane actually produces, which he began producing in 1995 after the Yehuda work was now available. So I hope I've answered your question. Both are very strong in understanding how or what the role of fats are in the human body. They both can appreciate that the heavy concentration of the omega-3s that we get in fish oil are absolutely hazardous to you. You have to provide the building blocks, which is what I'm going to talk about in just a minute anyway. You've got to provide the building blocks to build from the ground floor up to get all the essential fats and all the other fats that you need. You can't provide the end product like EPA and think that it filters down. It does not. Did I answer your question for you?
Yeah, basically, because I remember when Professor Peskin said he basically said a 1 to 1. Then he said a 2 to 5 to 1.
Oh yeah, he was all over the board there.
I'm assuming what he meant. Like you're better off with more omega-6s than not enough.
Yeah, it must be. See, that's where I say that I can appreciate Professor Peskin from his academic viewpoint. He's an electrical engineer from MIT. The man's brilliant.
Right. Yeah.
And so, boy, is he right on when it comes to digging into the science. But he does not have anything to do with helping people who are ill and are sick. And I'll stick with the clinician side of Ed and Patricia Kane knowing full well that they've determined scientifically through the work of Yehuda that the ratio is 4-to-1 because it has been determined by experimentation, not by study. Experiments done by Yehuda were able to lead us there, and I think it is the right way to emerge out of that discussion and know which way to go with it. So I've had a very easy time of deciding. I'm going with Ed Kane as a clinician, and I'm going with Brian Peskin as an academician, and I could separate them out, and I hope you can appreciate that I've separated them. I know how to compartmentalize them, and I pass on to you my recommendations based on that scrutiny. Okay?
Yes, and I'd like to thank you for having them on because they have definitely opened the eyes of a lot of people. I mean, because the fish oil was, I mean, it was everywhere.
Yeah, well, and it still is everywhere. And I just had a fond patient I'm very fond of yesterday. Still, and I'm looking at him, he's anguishing and lamenting over having to give up his fish oil. And so I say to all of you out there, hey, I'm not telling you to give up oils. I'm just saying give up that oil. There's harm to come to you on the long haul if you just switch over and move to the oils that will have nothing but positives for you and no negatives. It's going to be the 4-to-1, omega-6 to omega-3, little egg to alpha-linolenic, sunflower/primrose to flaxseed that's going to do the job at a ratio of 4-to-1 based on scientific determination that is the right ratio. So thanks for the question. I hope you can appreciate the answer.
Thank you very much.
A crescendo moment has occurred, folks. We have the bongos going on in the background. I have some other thyroid issues I promised to discuss at the next opportunity. When it comes to the alternative treatment, I think there's a lot of disservice going on out there with clinicians, doctors, treating you alternatively in an incorrect way. We'll do that another time. Until then, why don't you have a wonderful, beautiful weekend. Weather's going to be gorgeous. See you on Monday with Dr. Shandel talking about HCG testing to determine if there is cancer or not. And I believe it's definitive. Until then, so long now.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington